Morning, everybody.
Morning.
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 Morning. How are you?
Is that Jeannie? Hey, Jeannie, Secretary. How are you?
Hey, Madam Secretary. Look, who?
Right.
And there's Heather.
And is back again.
This is where I do my romper. I do my romper room here. I see Addie, I see Jeannie, I see.
We tease about Hollywood squares.
Yeah.
Yeah.
It's Brady Bunch.
There you go.
Somebody has a puppy dog somewhere.
You know, what's funny is when you go live stream on this and it actually opens up the YouTube in another screen. So you get it delayed.
Oh,
You say and I'm not that bright that I can go back and actually figure that out easily. So today I got it handled. So
All right. Practice makes perfect.
I'm not so sure. I got a whole week to lose that practice, you know?
I know. It takes 14 times to make a habit in a row.
In a row.
In a row.
We'll have to remember that, Steve.
Behavior shaping technique.
Yeah, I would ask everybody before we get started to mute yourselves, please. And I'm going to trust you all to say the pledge. When we do say the pledge, I'm going to trust you all to do that. Well, you don't have to if you don't want to. I shouldn't say that. I'm probably going to end up sharing a screen with y'all so we have a flag. Oops, I don't think you want that, do you? There we go. All right. Is everybody ready to get started? How about we rise and say the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Senator Eckert, would you be so kind as to open us up with prayer?
Thank you very much. Thank you all for joining us today. Bow with me. Our great God, we thank you for the wonderful opportunity that we have to gather together in this place from all of our separate places to be able to pull together our best concern, our best thinking, and our best ability to transform the gifts that you have blessed us with into being able to do the work of the people of the Eastern Shore in the state of Maryland. We thank you for those who are participating with us, for their ministry, for their service to our community. And we ask that you be with us as we deal with those issues that are so important to our citizens on the Eastern Shore, to the economy, to our kids and their education, to promoting healthcare, and to promote the dignity and respect of everybody that comes within our jurisdictions. So thank you now. Be with us. Help us to make the best decisions we can with the tools that you have provided us. In Jesus' name, amen.
amen.
Thank you so much. Real quick, housekeeping. Has everybody had a chance to check the minutes? If I could get a motion to approve.
Motion.
Second,
Second,
all those in favor?
Aye.
Sounds good. Thank you very much. Well, welcome everybody. It's a beautiful snowy day outside my window here, so it's good to have you all here, and hopefully we're all safe and snuggled. We'll get started pretty quickly here. I think first starting off, we have Hospice of the Eastern Shore. I don't know who's going to go first. Would you like to pick that?
Yeah, Steve, hi, this is Heather Guerreri. I'm going to start the presentation. I want to start off by thanking each and every one of you all for your service to our great state and the Eastern Shore. And I thank you for allowing us to come on to your Zoom meeting this morning. It's the first time probably in, I don't know, maybe 10 plus years that we haven't gone downtown to meet with you all in person. So it's different times nowadays, but we're doing our best. And we wanted to come and give you all an update as we do every year to make sure that you know that hospice and our industry is forging ahead through this COVID era, and we wanted to give you an update on how we have done, maybe some challenges that we are facing, and also some ways that we feel like you could be of assistance to our industry. So again, my name is Heather Guerreri. I am the CEO of Compass, formerly Compass Regional Hospice. We serve Queen Anne's, Kent, and Caroline counties. And with me today, I have Chris, I'm going to butcher your last name, I'm sorry, Chris Chikoris, and he is the CEO of Talbot Hospice. And then Elaine Capon, who is president of Coastal Hospice, and she is also the chair of our Public Policy Committee for the Hospice and Palliative Network of Maryland Board, and I sit as the chair on that board. We also have with us today Peggy Funk, who is our executive director of the Hospice and Palliative Network of Maryland. You all know that usually we also are downtown for Day in Annapolis, where you all come into the room and we give you all the update in person as well about the hospice industry. During that time, we usually pass out to each one of you all, or come up to your office if you're not able to make it, a fact sheet about each of our organizations, giving you some stats for the 2020 calendar year, services that we provided, patients we served. So I hope that you all got that. We had sent that out via email ahead of time. If you have any questions or concerns in relation to any of those or anything that we talk about in our presentation today, please reach out to us. And before I start with the presentation, I also want to thank Marty. She was instrumental in setting this all up for us. So thank you. So yes, these are challenging times for all of us, and we have all learned how to adapt, be creative in the way that we provide services, not only as nonprofits, but as government, as a country and a state. But through that, we feel like our hospice programs have done a stellar job in ensuring the healthcare for end-of-life patients on the Eastern Shore. We're going to talk a little bit about how we have adapted. We're going to talk about challenges that we faced financially, as well as getting supplies that we have needed. And then Elaine Capon is going to end our presentation by letting you all know where you might help us. So between our three organizations, we employ 342 people, and we have approximately 570 volunteers. Together, we have served 2,332 patients with hospice care in 2020, and over 1,600 patients in palliative care in their home environment, in nursing homes locally, in clinics, and in the hospital settings. We, again, have faced many challenges, as everybody has during COVID, but our hospice industry has stayed strong, even though we have faced many challenges. One of the challenges that I'm going to talk about briefly is the fact that hospices are reimbursed on a per diem rate per day from mostly the Medicare hospice benefit. That benefit says that patients can receive hospice for up to 6 months with a terminal illness. We very rarely see patients stay on service for 6 months, even prior to the COVID pandemic. Now, our length of stay has significantly decreased in all areas of the state of Maryland. And with that said, a decrease in census is a drastic hit to our revenue. That is our primary revenue source, is insurance reimbursement, as well as you all know, all three of us are nonprofit organizations. So fundraising is a significant part of our budget annually too, which I probably don't have to tell you has taken a significant hit during the pandemic as well. We also, I think we've done a very good job of being able to keep our employees employed. I believe all three of us have gotten PPP monies. Thank you very much. There's the CARES Act money that all healthcare providers got. That has significantly helped out, and mostly to be able to retain our employees, because with a significant drop in revenue, the major part of our budgets annually are human services. It's our employees that provide the services. We have been able to retain them through this, and that is great. But some other challenges that we have faced as well is keeping our staff safe during this, being able to get the appropriate PPE. And I know all of you all know that. I would be preaching to the choir to talk much about it. It's been very expensive, especially at first. Thank you all. Our legislators were great in helping to make sure that companies were not taking advantage of us during the pandemic in regards to spiking pricing. We have been able to get enough PPE to keep our staff safe. Several other challenges that we face is that we're going into the patient's homes a lot, and families who don't think it's necessary to wear masks and to be safe, and the education that it takes for our staff that's going in there to ensure safety. Families unable to visit their loved ones in our facilities. We've had to decrease the amount of people that come into our facilities to try to prevent that. It's been very challenging, if you all can well imagine, and you've probably heard many stories of patients that have died alone in hospitals. Hopefully not in hospices, because we have limited 1 or 2 people usually to be with the patient when they are dying, but they're not able to see their loved ones like they were. It's been very, very emotional and difficult times for all. And I think that's about it that I have of my part of the presentation. And I would like to now pass it over to Chris. And Chris is going to talk a little bit about our financial challenges and some other issues. Chris?
Thanks, Heather. And thank you all for the opportunity to join you this morning. As noted at the beginning, I'm Chris Chikoris, and Heather nailed my last name perfectly. So thank you. I have the pleasure of serving as the executive director of Talbot Hospice. I joined about 6 months ago, almost to the day. And it has been, for me, just an extreme pleasure and honor to serve in this capacity. As Heather mentioned, we've had and continue to experience a variety of challenges as an industry, and certainly no exception to those of us who are serving our friends and neighbors on the Eastern Shore. Whether it's access to patients in nursing homes because of the challenges that the nursing homes have experienced with the pandemic, or assisted living facilities, or just simply a reduction in referrals from other providers. And as Heather also mentioned, a significant decline that we've seen in philanthropic support due to economic pressures that are on our donors or on our neighbors, closures of our thrift shops. We've not been able to open some of those, or our inability to host in-person events, as you all certainly know and have experienced yourselves. So, but despite these challenges, we have demonstrated, I think, great resilience, as have a number of other businesses and organizations that have faced these same challenges. And we remain focused and extremely committed to serving our communities, our neighbors, our friends across the entire Eastern Shore community. We provide those personal visits, as Heather noted, and we also have leveraged, like no time before, the use of technology so that we can stay in constant contact with our patients, their loved ones throughout their journey in this dying process. So again, we've demonstrated our ability to pivot, to shift, and that resilience that I mentioned. And thankfully, and Heather also mentioned this as well, through the support that we have received through the CARES Act, through PPP and other funding through the government, state and or at the national level, we've been able to keep our heads above water. And as Heather noted, our largest portion of our budget is our people, and they too are our most valuable resource that we have, because they provide this tremendous service to our community. And as you know, the 6 months that I've been part of Talbot Hospice, and as many of you have may know from your own personal experiences, the people who work in hospice, by and large, are extraordinary people. They are compassionate. They epitomize the word compassion. So we certainly have benefited, and thank you again for your support in those efforts so that we can retain those staff and make sure that they can keep their family going with having a paycheck on a regular basis. So the one last thing before I turn it over to my colleague Elaine, just to again express our thanks to you all and your colleagues who supported the hospice community and made sure that our staff were near the top of the line to receive the vaccine as well. That was extremely important, as we play a vital role in healthcare. And I know that you all and your colleagues supported that effort to make sure that healthcare providers, frontline providers, had the opportunity to be vaccinated early on in the process. So again, we really appreciate your support and thank you for that. So with that, I will turn to Elaine, who will talk a little bit more about ways that we can work together and collaborate and support the hospice industry. Elaine?
Good morning, everybody. Thank you, Chris and Heather, and thank you, Eastern Shore delegation again. I would be remiss if I didn't talk about my first point a little bit. You should have a fact sheet on each one of us that provides the care to the Eastern Shore. And I'd like to point out that your nonprofits, excuse me, in the community, we provide things that are not covered in a typical hospice benefit. You will not find for-profit hospices or many hospices providing palliative care, because palliative care is in the literature as a net loss program. You will not find a for-profit hospice with a residential unit, because a residential unit has no reimbursement under hospice and is dependent on the community. Each one of our hospices provides residential care and palliative care programs, as well as community-wide bereavement and pre-hospice programs, which have no reimbursement. Part of why we're able to do that is because we are nonprofit and we do have fundraising, but also the Certificate of Need process in Maryland helps assure that we are serving the more populated areas, which helps us provide care in the remote areas. We are hopeful that this year will be a stable regulatory environment without changes to the Certificate of Need process, which would hurt the quality of the nonprofits you have in this area and our ability to provide those non-hospice programs. We would love to tell you more about that, perhaps after session, but right now we've got some bigger fish to fry that we'd like to talk with you about. The first item on my list is Senate Bill 486, House Bill 581. The Hospice Network of Maryland opposes this bill. This is the employment standards during an emergency. We particularly object to the hazard pay of $3 an hour during emergencies. One issue is that it's unclear as to whether this could include weather emergencies when we have a snowstorm and our staff must go to our residences or our inpatient units. Also, during the span of this pandemic, which began in the middle of March last year and is expected to go through the calendar year of 2021, that's 21 months of an emergency. Along with the requirement to cover costs that are not covered by insurance, These two things for the hospice community create more than a hardship. The definition of essential worker, relying on that they are unable to do their work remotely. This does not take into account any sort of risk factors. So the person who has to come in because the access to Medicare is on one desktop computer, where would they fall in this hazard pay? The bill allows employees the ability to refuse assignments. And in healthcare, that is just not heard of. We didn't do this during the AIDS epidemic. We didn't talk about it when we were all talking about Ebola. It also mandates additional time from what our industry, the Maryland Sick and Safe Leave, and the Federal Families First Act already provide. It mandates multiple administrative requirements on companies, including the development and submission to MEMA and local emergency management offices, an emergency plan, as well as reporting of staff test results of infectious diseases to Maryland Department of Health. Well, the Maryland Department of Health already has those safeguards in place. And although we don't submit to MEMA, any healthcare that is licensed is already required to have emergency management plans, as well as infection control and mitigation plans. We feel that hospice should not be included in this bill. We also take exception to Senate Bill 727, House Bill 1326. This is the Maryland Healthy Working Families Act, Revisions in Public Health Emergency Leave. Again, this bill requires additional leave to what is already provided. 112 hours in this bill for full-time employees for many reasons, such as isolating, caring for themselves if they're sick, caring for others who are sick, and preventive care. The bill is very broad and the definitions need clarification, particularly around who is family and what means preventive care. The bill restricts employers from asking for documentation about illness, which promotes the abuse of the benefit. It also speaks to taking the leave regardless of whether there's been a diagnosis or not. And we believe a diagnosis from a medical professional should be provided if the employee is taking 112 hours or some portion thereof because they are ill or because they are caring for someone who is ill. We feel that this should not apply to hospice. We also have a concern regarding multiple bills that are in place that deal with workers' compensation claims. There are several bills that have been introduced that are basically doing the same thing. These bills basically state that if an employee works in a healthcare facility that treats or diagnoses COVID-19 patients and they contract COVID-19, then it is presumed that the employee got it at work and can file a workers' compensation claim. The employer can rebut it and put forth evidence to the contrary. Some issues we have with these bills is that there's no required real causation. Contact tracing data shows that 75% of individuals contracted COVID-19 from small gatherings. And I can tell you from personal experience, we have had a number of employees who have tested positive or been mildly ill from COVID-19. Only 10% got it from work. We feel that this will hurt the employer-employee relationship because employers will need to begin trolling social media accounts and infringing on private lives of employees to determine what their activities were outside of the office. The Workers' Compensation Commission is already adjudicating these cases, and we feel this is the appropriate forum for that. And it will significantly increase insurance costs. So in closing my portion, I just want to reiterate that we are essential, very service-oriented businesses in our community. We already pay very competitive wages because there's been a healthcare shortage that's only gotten worse in recent years, and salaries for individuals have gone up markedly. We already provide 2 weeks of leave through the Family First Act and an additional 5 days through the Maryland Sick and Safe, in addition to other healthcare standard PTO leave benefits. We hope that you will consider our concerns, which could have grave consequences for our industry. We appreciate you all very much. We appreciate this time you've taken to spend with us today. And we appreciate the support that you have shown us. And again, I thank you. And if you have questions for us, we're here.
All righty, I'm looking for any hands raised. I have Senator Addie Eckhart.
Thank you very much, Mr. Chairman, and thank you to our hospice partners. We appreciate all the good work you've done. And it's been a difficult year, I understand. Are you aware that of Senate Bill 496? Senate Bill 496 is the Governor's Relief Act, and the Senate added some recovery measures. In there, there's an amount, I think it's up to 30 million, that provides relief for not-for-profits who have not received any assistance in the past. So if you haven't explored that, and if you're eligible for that, that money will come down through the local counties. So let your counties know. And I know the comptroller was trying to get all of that rolled out pretty quickly. So we can get you more information as we get more information, if that would be helpful.
Thank you. We will absolutely look that up and see what assistance we can get in that.
And again, thank you, because I know it's been hard. We've lost a lot of people in the last year.
Mm-hmm.
Thank you.
Thank you.
I have one more question. I'm sorry. I just thought of something.
By all means, Senator.
I apologize. This one's important. I've gotten a couple of calls from families who were not able to utilize hospice services in one jurisdictions. Do you have any kind of reciprocity, I guess I would call it, between yourselves, so that if something doesn't work in one hospice, we should send people to the other hospices? And I know sometimes there are unique circumstances.
Right. Yeah, Senator Eckert, that's a really great question. And there's a couple answers to that. Certainly, if somebody is in need of a hospice bed, any one of us can take them in our facility because the certificate of need kind of ties our hands in regards to, if you do not have a certificate of need for that jurisdiction, you aren't supposed to be providing services.
Correct.
Certainly in the past, we also, because we are a very collaborative industry, we have contacted each other and said, hey, we got this call, or we can't accommodate this. Can you help out? And we all certainly would help one another out in that circumstance as well.
So
And
great. And so when that happens and we get a call like that, should we just direct it back to the hospice from which they were told, no, we can't serve you, or just direct them to check with the others?
I find it more meaningful if you have time, if you have a relationship with one of us, if you would reach out to the designated hospice or anybody within the area that you have a relationship with, and then we can communicate with one another. Because I feel like oftentimes if you leave it up to the referral source, it's already a difficult call to make anyway. They're frustrated. It kind of takes that burden off of them now, and then directly to us, and we will make sure that we make contact with them.
Okay, so we could defer that to our staff and
Yep.
find it.
Absolutely.
Great. Thank you. Thank you very much. Thank you, Mr. Chairman.
No problem. Delegate Hartman, please.
Thank you, Mr. Chair. I want to thank the three of you for being here, for what you do. I appreciate you sharing your legislative priorities with us, or not priorities, but concerns. And I think everybody knows I'm all too familiar with the work you do, and appreciate it.
Thank you so much.
Thank you very much, Delegate Hartman.
I had a question, if that's okay. The information you're sending us on this bill, the 581 is a real important bill to us as far as the Essential Workers Act. But if you have some additional information, if you want to forward it, would appreciate any guidance on that, because we are fighting that, looking at the bill very closely. For anyone of you, I guess, since I'm your local person, could you help us out with just a brief explanation on how you're handling, if my mother were with you right now, what are you doing for me as the family? Can you just tell us all the things? Because a lot of people are confused, and I get a lot of questions about, I'm not allowed to see my mother or dad in their dotage, whatever.
Right. Well, that is different. Each hospice organization has their own policies around COVID, but I can speak for my organization, and then maybe Elaine and Chris can pipe up as well. If two circumstances, obviously, or three really, they're either in a skilled nursing facility, which has its own barriers other than just hospice, or in one of our facilities, or in the home environment. We are seeing patients in person, and we are allowing visitors within our facilities. My facility, it allows 2 visitors per day. Those 2 visitors can be different every single day. If somebody is actively dying and they choose to stay and spend the night, they're allowed to do so as well. We just have real restrictions on not going into common areas, so that there's not a lot of cross-contamination within the areas that people generally kind of gathered in. And there's certainly not large groups of people. Otherwise, as far as, I think you might also be talking about grief, and I'm glad, because it was a great segue into, I wanted to bring up before we finished. I know everybody realizes that we provide, bereavement or grief support, but we provide it to everybody in the community. It's not just for people who have had our hospice services or that have had a loved one die on our hospice. We provide it for suicides, car accidents, any kind of traumatic things. We're in the school systems providing it to the kids. More than ever now, we have utilized platforms such as this, Zoom and others, to make sure that we stay connected, because as you probably well know too, the grief is much more complicated now with COVID. Not being able to be present like people could before, guilt of that after a death during the grieving process. It's just much more complicated. So our grief services, and I can speak to mine, I'm sure, again, Chris and Elaine can speak to theirs. We have increased the amount of grief contact or touch points that we have done. It's not all in person. It's a lot of virtual things, but it has been significantly received within our community, and people have felt the support, and we're getting more and more referrals just from community members that have had a loss.
So
Steve, if I can add for Coastal Hospice, I can tell you they were great about bringing the entire immediate family in. So, if we were somewhere else, that wouldn't have been the case. So
Right.
There is a difference.
there is a difference. And again, that residence that you experienced, Delegate Hartman, is one of those services that a for-profit hospice won't do. As you know, there is no reimbursement for it, and it's either private pay or sliding scale, and some people can't afford much of anything. I did want to also mention it has been very hard in the homes. All of our disciplines, chaplains, social worker, nurses, aides, are all going in person. We did stop having our volunteers go, with the exception of they're making phone contact, sending cards. They've dropped off flowers to the house and things like that. The visitation has been different by facility. As Delegate Hartman said, we've been able to limit, but still be pretty, pretty loose about the regulations, about our own restrictions on visitors. And we even started to do rapid tests on visitors to our own residents. At our inpatient unit, which is housed at the Deer's Head Hospital, we are committed to following their rules, and they are allowing one person at a time up. And so it hasn't been just one person a day, but if one person goes up in the morning, a different person can go up in the afternoon. And they've been very flexible with us when somebody is getting very close to death. They've allowed as many as 5 people up to be with that person in their last couple days. The nursing homes are a whole other story. And what we have seen on a number of occasions is because of the nursing homes being on lockdown and families not being able to get in to see them, we have gotten a number of referrals to send somebody from the nursing home or from the hospital to our inpatient unit or to our residents so they could die there and have their family with them. And so that's part of that short length of stay. We get them and they're gone 2 days later, because the whole purpose of them coming to hospice was so they wouldn't die alone.
Okay, I appreciate those answers. Delegate Riley.
Thank you, Mr. Chair. Appreciate this. I'm not sure who can answer me correctly, but I'm an HGO. So yesterday in bill hearings, we heard a lot of bills in reference to nursing home, assisted living, visitation rights. And we kept hearing from, for one, the Maryland Department of Health, that basically all of the assisted livings and the nursing homes under the current Emergency Act has to follow the CMS guidelines. And if any of the nursing homes or assisted livings went outside of those guidelines, that you actually the homes through Maryland Department of Health and the Office of Healthcare Quality could have found and actually given you citations. So that's true. So the second part of that question. So they're saying that we really can't do any kind of legislation because we always have to follow the CDC and the CMS guidelines. So your hands are kind of, tied together.
Right. So we are not nursing homes. We are a contracted service within the nursing home.
Okay.
And yes, their hands are tied. Hospice has been outside of a lot of those regulations, although I will tell you, when we have had a positive patient, the local health department has given us a lot of guidance on what to do. It's a different situation because our residences are small. We don't have 200 beds. We've got 12 or 9. So it's a very different situation, and it's much easier to control both the numbers of staff and the numbers of visitors going in and out when you've got 9 or 12 beds rather than when you've got 200.
So you don't have to follow those guidelines through the CMS at all. So they don't.
Not the nursing ones.
Not the nursing home.
We have separate guidelines that we're required to follow.
Now,
So nursing home guidelines are one, and then we have others.
Okay, great.
And
Thank you for that clarification.
There were some things about congregate living situations that did apply to us.
Okay. All right.
And
Thank you very
again,
much.
there were always end of life exceptions written into a lot of those, and that's what we do.
Okay. Thank you.
Thank you.
Okay, I don't see any other questions. Group, we thank you so much for coming, each and every one of you. It's always a pleasure. And I think you have the delegation support in most everything you do. Appreciate you being here, and thank you for everything you do.
Thank you so much.
Take care. Stay safe.
We'll get you information on 581. Thank you.
Or anything else you want to give us, we'd be happy to look at it again. Everything helps.
Thank you so much.
All right.
Hey,
And now,
Appreciate
ladies
you
and
all.
gentlemen. Thank you.
Elaine, pressure's on. That'll be 113 days, okay?
If I could just mention before we hang up, none of us said this, but I think you all know Dana Kaufman is the lobbyist for the Hospice and Palliative Network of Maryland. And so she also, I'm sure, is in your ears often too, in regards to the bills that we would like support on or that we oppose. So just wanted to make sure that you all were aware that she was our lobbyist.
Okay, we got that. Thank you so much.
Senator Eckert?
I'm sorry.
Senator Eckert, do you have a question?
I just wanted to say you're in good hands with Dana. There isn't anybody who understands this organization, these long-term care, any better than Dana does. She was one of our staffers years ago.
That's great news. Okay, we're running a little bit out here. So without further ado, I'd like to introduce one of our ex-own, an ex-PM delegate from the Eastern Shore, our Department Secretary of our Secretary of Natural Resources, Jeannie Hadaway-Riccio.
Thank you, Mr. Chair, and good morning to all of the delegation members. It's great to be back with you. I understand that many of you are pressed for time this morning, so we are going to abbreviate our presentation, but feel free to let me know if I missed anything or if you have specific questions. But I thought I would start with a quick update on program Open Space, because I know that is a program that is very important to us at the state level, but also with our local jurisdictions. So as you're probably well aware, parks visitation has been extremely high. In fact, we saw 21.5 million visitors last year, much more than our previous record, which was 14.9 million. And our local parks and community parks and playgrounds also were experiencing the same thing. I would just point out that this trend was already occurring even before the pandemic. So we anticipate the demand for outdoor recreation and green space to continue in the out years. And so we are very concerned about two recommendations from the Department of Legislative Services. The first is to cut program Open Space stateside by $34 million. And the second is to eliminate the repayment program. So as you may recall, the previous administration had taken some money from program Open Space to balance the budget, and Governor Hogan committed to repaying that funding. Those repayments support our ag land preservation programs, program Open Space Local, critical maintenance for our parks. And so this funding is really important for our jurisdictions, our farmers, our resource-based industries, and of course our state. So we would appreciate your support in rejecting those DLS recommendations. I also wanted to update you on our CARES Act relief funding for the commercial seafood industry. We have been administering a grant program for relief to participants in that sector. And so far we have had 950 applicants apply. We have about $750,000 out the door in direct payments to those individuals. And the deadline to apply is coming up on February 28th. So we do anticipate getting a few more applications, but things seem to be progressing really well. And we are turning those applications around as quickly as we can with our federal partners to help provide some relief to the seafood industry. Along similar lines, we have really been focusing on the forestry industry, which is important to our state economy, but particularly our rural economy. And so we're in the process of finalizing the economic adjustment strategy, which we've been working on with a number of partners, including EDA, the Department of Commerce, the Maryland Forest Association, Western Maryland RC&D, and of course, the Tri-County Councils and the Rural Maryland Council have all provided input and been a part of that process. And with that economic adjustment strategy, we will have some very specific initiatives and strategies that we can use to strengthen our forestry industry in Maryland. And then last but not least, we wanted to touch on a couple of our DNR legislative initiatives for your awareness. We really tried to focus this session on recovery and relief for the private sector partners that we work with so often, but also ways to grow our economy and grow those industries. So I'm going to turn it over to James to talk about a new potential fishery in the Bay, some aquaculture opportunity expansion, and of course, our efforts to address invasive catfish in the Chesapeake Bay. James?
Thank you, Madam Secretary. Hello, delegation. Good morning. Starting off with Senate Bill 343. This bill authorizes the first new commercial fishery in many, many years, it would seem, and that is the shrimp fishery, which has slowly grown informally. The industry that is doing the folks that are doing the harvest of the shrimp had asked us to set guardrails on the fisheries and to eliminate any gray area and make it a new bona fide fishery. Then we have Senate Bill 350, which allows for the exploration on the commercial viability of aquatic grasses in the Bay. Currently, we don't have any ability to allow interested parties to pursue, the viability of growing seagrasses for commercial purposes, such as protein and even potential pharmaceutical applications. And the last, but certainly not least, again this year we have a joint resolution in urging Congress. The members of Maryland's delegation to press the USDA to alleviate, the nonsensical regulations around processing invasive catfish species such as blue catfish, but also flathead. And I'm pleased to say all three of these initiatives I've spoken about this morning have already passed the Senate. And I believe there's going to be a House hearing on Monday on the House version of the blue catfish resolution. So I'm happy to take any questions now or offline.
Are you the final speaker, James?
I am.
Okay. First, we have Senator Carrozza.
Thank you, and thank you, Madam Secretary, and to our terrific DNR team. Obviously spending a lot of time with James in Senate EHE. 3 quick points, Madam Secretary. First, want to thank the department for working with us as we're trying to go through the massive climate change bill in Senate EHE, and the information that DNR has been providing to us has been very helpful. And I think you've already seen as a result, we've been able to walk back. Chair Pinsky has actually taken some of that information and has made some amendments based on the information you provided. So thank you for that. Please keep working with us. 2 quick questions. I just wanted, if you could comment on the email that you sent out earlier this week on the Menokin with the seed restoration. And also, I wanted to make a formal request. I'll follow up in writing, but my locals in Crisfield are working on downtown revitalization, focusing on the waterfront. And they have specifically asked if they could have a formal update from you or your senior advisors on the work and the plans for the marina, both current and in the future, so we can work together on their downtown revitalization plan consistent with you and I think the possibility of the public-private partnership that we've talked about in the past.
Sure. Okay. Well, let me start with your question regarding the Menokin. So as many of you are aware, the Menokin River was selected and approved as the 5th restoration tributary under the Chesapeake Bay Agreement. And we are in the planning phase right now. And so we do have a public hearing. It will be a virtual public hearing scheduled to go over some of the plans for the restoration activities and also to solicit input about very important things like placement of substrate, where in the river to do the restoration, What we have also done is produced a video. So if people cannot participate in the public meeting that evening, they can watch the video on their own time and get the same information and still have the opportunity to provide public comment and input, which is going to be really, really important for us as we finalize the plans there. And then regarding Chris Field, we'd be happy to follow up with you on that. And thank you for recognizing the work that James does. James and Bunky Luffman is with us this morning. They're both superstars on our team, and hope you will continue to work with them and rely on them whenever you need anything. And of course, myself as well.
Delegate Jacobs.
Thank you. Good morning, Madam Secretary.
Good morning.
Good to see everybody here this morning. It's kind of icy Friday morning. Be careful. I want to talk a little bit about the impact of this proposed change in recreational rockfish season from August to July. I know that it's been a pretty hot topic especially with the charter boat associations, and I know it's going to have a huge economic impact because of July is kind of the prime time on the shore for recreational fishing. So has there been any movement to take it back to August, or are you still trying to stick with this July closure? Because I know you've gotten a lot of emails. I've probably got 250 or more.
Yeah, so the public comment period on the proposed regulations just closed a few days ago, and our staff is in the process of compiling all of those comments. We will go through all of the feedback that we received and then make a final decision from there. We do totally understand that this is a difficult situation for recreational fishers, for charter boat captains, for the commercial sector. Unfortunately, we are at a crossroads in conservation of striped bass populations, and we need to take some pretty bold actions to right the ship. And we are doing everything that we can to be as aggressive as we can while still being conscious of economic effects, but in order to avoid a moratorium or more severe consequences down the road. So it, as always in fisheries, it is a big balancing act, and we are definitely taking everyone's input very seriously as we work through the process.
Right, and I know that the quota this past year was a little over 1.4 million. Can you tell the delegation where the numbers ended up for the year? How far below the quota the actual catch was, the harvest was?
So I do not remember that number off the top of my head, but I would be happy to follow up and provide you with that information. I do know that in 2020 we were slightly below the allocation.
Yeah, I understood it was about 500,000 pounds. So I'm just trying to get some real numbers, because I'm sure that could have some bearing on potential movement of closures and conservation issues.
So I will just say that the Atlantic States Marine Fisheries Commission right now has a public information document out for review and public comment that is informing how the next stock assessment will take place, and it will likely be 2022 before the next striped bass stock assessment takes place.
All right, thank you.
Next up, we have Delegate Otto.
Thank you, Mr. Chairman. Madam Secretary, welcome back for the
Thank
meeting. Good to see you, and I thank you for your response to me this week of pertaining to the Minokan River. And but I just want to express my concerns about the outreach to get people that are real stakeholders in the Minokan River to participate in the process. I see letters dated the 12th of going out to Oyster Recovery Commission people. And I see things dated, oh, maybe it was the 12th that it went to the landowners around it. And I'm still getting Christmas cards, and that's a little difficult notice to expect the post office to get that to the people. So I think that's enough said, and I'm just concerned that the people that have knowledge of the Minokan River and where it is appropriate, just because it was a Yates bar in 1923 doesn't mean that's the appropriate place for recovery. Thank you.
So we definitely agree. And again, that's why we also put the video together. But please don't think that this public information meeting is the only type of outreach that we will be doing or have done. We had a lot of stakeholders that were involved in drafting the restoration plan for the Minokan. The Oyster Advisory Commission was very involved in the review of that draft plan. And so we will continue to be conscious of the difficulties that the pandemic has presented in terms of getting public feedback. And we would also ask that you please help us to disseminate the information to people that you think would be interested in it or are important stakeholders in the process.
Okay. Next up, we have Senator Eckhart, but I just want to, as soon as she's done, Delegate, my vice chair will take over. I have to go to a subcommittee meeting. So thank you for your time.
Thank you, Mr. Chair. Thank you, Madam Secretary. Always good to see you. I've had the opportunity twice this week. Just wanted to thank you for your work with the Oyster Project there at the Choptank River at Selwyn's. I know the Cambridge Waterfront Development Committee are really excited about that initiative. So thank you, and to your team and the management of that fishing pier. I also just wanted to say thank you so much for your work with the deer hunting issue down below. Hope we get some measures in place to be able to curtail that, and for all your help in being able to facilitate those grants to the watermen who could really use it. It's been a very challenging time for them as well. And then I have another initiative I'll talk to you offline about, how we can retain and recruit our existing watermen and their families. Thank you.
All right, well, thank you for mentioning the Bill Burton Fishing Piers. We're really excited about the work that we're doing on both the Dorchester and the Talbot side. And it's a great example of some of the economic development and tourism related projects that we have going on across the Eastern Shore in the state, including Fair Hill, our work along the Pocomoke, Ocean City Beach replenishment. We have a lot of big projects and a lot of good projects in the pipeline, and we appreciate the support that we get from all of you that are members of the Eastern Shore delegation for those projects.
Senator Eckert, do you have any more questions? I think she's muted.
Your turn. Thank you.
Okay.
Oh, good.
This is virtual. We do this virtual thing with moving the gavel around. So it just virtually flipped over Secretary Hadaway Riccio. And I guess I'm the Chairman Aaron's mentioned I may be the last person to have questions. Just very quickly, I just wanted to bring one point up, and I'm not sure if Natural Resources Police were involved, but we had a man overboard situation yesterday right off of Nevitt, and I believe Natural Resources was involved in that. I know a couple local fire companies were involved. So please share our appreciation for all the men and women in the force for, you know, they've got to enforce the laws, and it's an adversarial thing oftentimes, but they're all out there on the water together. And to anything they did to help save that life is just tremendous, because it's treacherous and everybody's having a tough year, especially trying to make a living on the water. Flipping things around, I'm interested to know if you've heard anything about last year's goose report, the goose population report, and kind of what we can expect to hear about this spring's survey when they do that up on the peninsula up there in Canada.
So thank you for recognizing the NRP officers that were involved yesterday. Thankfully, there was a good outcome to that story. 20 minutes in the water with these temperatures, it really was a miracle, but we will definitely pass on your kind words. And regarding the goose population studies, we can get you the specific information. At this point, we don't anticipate any changes in our regulations. We still have quite a ways to go with our population numbers to get out of the 30-day season and the one goose bag limit, unfortunately, for migratory. But we'll definitely circle back with you on the latest information we have.
And I'd personally be interested to know if there's anything we can do as a state to affect our influence on that flyway commission. I think there's an overwhelming amount of science that would show that those geese fly to New York and then they come to Maryland just based off of weather. And, you know, we're at a harvest, we're regulated at a different level than other states on the flyway. And that's an old issue, but that definitely deserves revisiting. I think the overwhelming majority of waterfowl enthusiasts would probably support looking at that federal rule, but it's difficult because it's a federal issue. So if we can help, please let us know.
Thank you. I appreciate that. And you're right. These multi-state compacts can get a little tricky at times, but we appreciate your offer to help.
That concludes my questions. I don't see any other hands raised. Any members, do you have questions for the secretary? I do it a little differently. Going once, questions for the secretary. Going twice, second questions for the secretary. That means no questions. Thank you very much for taking the time to join us this morning.
Thank you for having me. Great to see you all.
Thank you.
Thank you.
Thank you.
Okay, ladies and gentlemen, I'm at the helm now and I don't have my agenda in front of me. So I believe that was our last scheduled presenter this morning. However, I believe we have representatives from our federal delegation on this Zoom call. I'm not sure exactly which ones, but we'll start with Senator Cardin's office. Is Kim Cradaville, are you on the call? Would you like to share anything with the delegation?
Johnny, if she doesn't respond, her state director called her a few minutes ago, so she had to step away.
Well, how about we move over to Senator Van Hollen's office and take the word from the Senate.
Okay, by the time we're done, maybe she'll be back on. Just a few quick updates. 3 fire departments on the Eastern Shore received FEMA Assistance to Firefighter grants for PPE equipment. That was Denton receiving $35,000 roughly. Princess Anne got $9,200 and Hurlock got $2,700. We continue to work very closely with those fire departments to encourage all of them to apply. We're in constant communications with them. Also, Salisbury Neighborhood Housing Services received $230,000 from NeighborWorks America. That's a grant that they generally get every year, but it's always so appreciated. And they're doing such good work in Salisbury. They've been assisting with the pandemic relief and getting that rental assistance out. So Cheryl Meadows is fantastic. If you don't know her, you should. I want to thank everybody in the delegation for passing the relief package to Marylanders in the Senate. You might not see our senators on the floor, but it's because it's recess, but we are working behind the scenes, our staff and the senators, very hard to get this next package out. And the senator will be joining you next Friday. So I generally solicit this by email, but if you have any concerns, please shoot me an email and I'll have him address those next week. Thank you always for having us on. Enjoy the presentations and appreciate all your hard work. Thank you.
Thank you, Melissa Kelly. How about Congressman Harris's office? Keith or Mike, are you guys on?
Yeah, thank you, Deputy Chair Mounts. Keith is on, so he can chime in. I think he's on the phone. First of all, just wanted to mention that Congressman Harris has voiced his opposition to the masking requirement for watermen. I don't know if anybody from DNR would like to comment about I understand that DNR is not intending to enforce that as a requirement, but Congressman Harris is in opposition to that. Keith is on the 2020 Safer Grant Program, opened on February 8th. Keith might want to comment on that. And then finally, the entire Maryland delegation, including all the Maryland congressmen as well as senators, announced a $5.5 million community health centers grants across the state. So maybe Melissa or Kimberly might want to comment on that, because most of that actually went to the western side of the state. Keith, you have any comments on the Safer Grant Program? I guess not.
No.
So that's it for me.
Mike, thanks a million. To see you this morning.
I'm not Kimberly.
Hey, how are you?
I'm doing well. Thank you, Melissa. I had a call from my state director quickly, but I did want to highlight the designation for the All-American Byway too. The road that's the 400-mile route from Chesapeake City to Crisfield, and the designation for the All-American Road and the All-American Byways, which is pretty cool. I also wanted to say, I know the folks from Cecil County will miss Heather Campbell. She is my counterpart that covered Cecil and has moved to Australia with her family. So I did just want to say that I will be covering Cecil for the time being. So I will reach out individually, but please feel free to reach out with me with any federal concerns.
Terrific, Kim. Thank you for taking the time to join us. That wraps up our federal delegation. Scott Warner, Greg Padgham, anything from Midshore or Lower Shore councils that you'd like to share with the delegation? Going once?
No.
Going twice? What's that, Charles?
Scott came alive. I see his picture on there now.
I thought Greg was going to say something there, Johnny, so I didn't want to cut him off. We'll be updating our boards very soon. Most of you all do know that we were very gracious, received EDA grant from the CARES Act, and we're working together with Salisbury University on developing some dashboards that's helping our counties. So we'll be releasing probably in the next couple of months the very first project, but we're actually moving very swiftly on 3 different projects right now. Anything to add, Greg?
Yeah. Well, I think that, thank you very much for that, Scott and Greg. We wish you guys the best. We're 10:05, which is our scheduled adjournment time. And I think that does anyone else have anything for the good of the order that would like to share with the delegation? See any hands raised? I see no virtual hands, so we have no more for the good of the order. We've reached our time for adjournment. Is there a motion that anyone would like to make with regards to adjournment?
So moved.
Second.
You got a second? All in favor?
Aye. Thank you.
I think
Happy Friday, everybody.
Yep. Y'all be good today.